business should not just be all about, making money. It should be kind of a calling and something that you give back and you feel like you're helping folks. I've been in tech companies before. That was kind of about just geeking out about new technology that'd be cool to try out with people. And finance is all about things like arbitrage. How much money can you make off of a deal and opportunity? Obviously, the money you get can help people, but it's not.
All right. Were there ever points in time when you were younger that you felt that you had passion for like the medical field at all?
Not at all,
That's
right?
wild.
Yeah, so it was one of those things where it developed, like I talked about my story about my daughter being sick and when she was first born, and just seeing all the work that goes into building out a great team and organization when it comes to healthcare, and just really seeing all the work that they do to help patients got me more passionate about healthcare. And then seeing opportunity that could be a business I can build in this space really was something that got me excited about it. And because, I think business should not just be all about, making money. It should be kind of a calling and something that you give back and you feel like you're helping folks. And all the businesses, I've been in tech companies before. That was kind of about just geeking out about new technology that'd be cool to try out with people and stuff like that. Obviously, finance is all about like things like arbitrage. How much money can you make off of a deal and opportunity? Obviously, the money you get can help people, but it's not directly impacting people's lives.
Agreed.
Whereas healthcare is directly impacting people's lives, right? We all have family members, right, that suffer from different kind of health conditions. And we all get older and we all have those type of conditions, and healthcare is really trying to understand that condition and help patients live. I mean, you have your wealth and your health, but how many would give millions and billions of dollars to have more health? So it goes to show you that health is way more important than wealth a lot of times.
It's funny that people complain a lot about the healthcare system in the United States, but people also forget, like, go back 100 years ago and look at the progress that we've made.
Yep.
And like how we could help so many people with all these sicknesses that were relatively unknown, even as recent as like, our parents and grandparents' lifetimes. I also agree with the point where like I was in finance, I was on Wall Street, and I always felt that the issue was I wasn't really helping anyone. I was making money, and I guess that money could be used to help people. Like I worked at Citi, they had programs in Africa that were helping. But in the end, just like you said, healthcare, you're directly helping people with their health, which is so important. Then as you're going through business school, I assume you get exposed to a ton of different people that are interested in all these different fields, whether it was law, healthcare, any business really. What was going through your mind when you even went to business school?
Yeah, so I was in the tech field right at the time, and I thought that technology was key to everything, right? I'm an engineer by training. Every problem could be solved, by technology, right? But then I exposed my ideas and thoughts of like, hey, to run a business, you need operations and you need finance and you need marketing and you need sales and you need all these different components. So it really exposed my ideas to like what's possible. And so, I think I was okay. Engineering wasn't the best, right? I could get by, but I felt that, I had other skills I could do in business when it comes to healthcare specifically. And so, yeah, I took a lot of classes. One of the classes I took was venture capital to kind of understand a little bit more about that model. Thought about management consulting, working with big consulting companies to come in, higher level and talk to the CEOs or executive suite about how to solve their business problems. So I've got a lot of exposure with that before and done some consulting in that area as well. But it wasn't until like I started to understand like how you can combine all these different things and to a specific problem set like healthcare, then my mind started to get opened up more to what's possible. So yeah, having an MBA is really important, I think, but it's not the end all be all, because to be honest with you, I've learned more on the job, because as you're doing the job, you start realizing all the things that needs to be done to be successful. So I had to learn about like the practices, like how practices are even run, how to get reimbursed. So we started first talking, maybe at the booth and throughout this session, we talked about, you asked me like, how do people get paid? How's the reimbursement? I had to learn all that, right?
Yeah.
And it could be very complicated because, most people just go to the doctor once a year, if that, and they have no clue, like, how bills are set up.
You
And
don't care, it doesn't affect you.
Well, and I think it's purposeful, because the healthcare system is probably, just like in finance, I'm sure, there is a opaqueness that they create, right? So it's hard to understand exactly what's really going on.
Food's the same way.
Yeah.
Agreed.
Food, technology, right? There's just a way that, it's too complicated, don't worry about it, we'll handle it. So that way you are not trying to get into the weeds understanding it. And just like healthcare, once you can understand what drives this, which is basically just like anything, finance, then it can help you understand like economics, right? If you're economics major, if you've been an economics major, you know incentives drive behavior. So because the doctors are getting paid by a third party, their incentives are not aligned to the patient care all the time. It's aligned to what the third party is telling them that to be aligned for. And also, we're going through a major shift in the last like 20 years between Obamacare, you know, the Affordable Health Care Act, which transferred everything from paper and to electronic records, you know, to digitize it. That was a big shift. Then looking at that data and determining like, okay, what things are helping the patient care. And that's been a big shift because doctors were doing like fee for service. You come in, they see you, do the service, and they get paid. They're trying to decouple that now, CMS, and trying to do what they call continuum care. Yes, Jack came in to see me and I did the service, but wait a minute, Jack is still sick. So guess what, doctor? You're not gonna get paid as much anymore because Jack still went to the hospital even though you saw him. So now the doctor is more on the hook for the whole care as opposed to just, did they see you or not?
Interesting. So I guess I have a lot of, you said some really good points in there, but the last thing you mentioned, when I got my braces, the way that it worked is it was like a one-time fee and it was until my teeth were fixed.
Mm-hmm.
So like, it's almost like if I was sick, it's like until I get better. Is that the model where like it's a sick patient comes in and the doctor's like, I am yours until the patient is cured?
Absolutely. I mean, a lot of doctors that listen to my channel are just people just interested in just how healthcare runs. That's exactly it, right? It's more aligned. So there's a difference between acute care, right? So basically you have a broken arm. Someone fixes that. That makes sense, right?
Mm-hmm.
You know, trans is one time fix, you know, move on like surgeons, you know, they cut something out, you know, and you heal over time. But then there's that other area of healthcare, which is pretty much about 80% of healthcare, which is those long-term conditions that affect you, right? If you have diabetes, the hypertension, if you're dealing with other like mental illness even, right? You know, these are things that take time to cure, right? Or even prevent, right? By healthy eating or by just managing patients' behavior. And so I think that's where healthcare is gonna change more, is where they're really trying to put more onus on the patient to take care of themselves, be more preventative, and then incentivizing the doctor to do more of those efforts. And that's why a lot of doctors are now, you know, just talking to at this NMA conference that we're at today, a lot of doctors are frustrated. You know, I don't know if you talked to some of the doctors that heard me talk to them. A lot of them are saying, hey, you know, I'm getting retired. I'm trying to get out of the business, right? Because they see it's harder and harder to be a doctor. They enjoy talking to patients. I think you kind of have that in you if you care somewhat as being a doctor. But the administration that goes around it, from the EMR stuff, the databases of patient records, the EMR, electronic medical records, to just the shift to how they get paid, a lot of doctors are fed up. And so that's kind of why we built the company, right? To kind of help doctors understand the benefit of these programs and to take advantage of them now, ride the wave. If you're going to be a doctor, just be aware of how to take advantage of these programs, because you're going to go under toe and you're going to get frustrated and you're going to end up being an employee. And a lot of doctors as employees now, they're just not getting compensated as much. Mm-hmm. And they're asked to do more and more work.
Yeah, agreed with that. Also amazing points. First thing I want to go back to is third party. So you mentioned the process of how doctors' incentives are not, I want to tap into that a little more. Mm-hmm. That's a kind of an important thing to talk about, if you don't mind. Can you just like elaborate as to what that incentive structure is for a doctor? So like you say, a third party is the one paying them and like they're not necessarily always incentivized to give the patients the best care. Yeah, can you just explain that for someone who might not even know medicine that much?
Absolutely.
Curious.
Well, you're a finance guy, right? You know, there's a thing called the agency problem, right? And so they're not aligned. So like if you have a financial planner and they're not incentivized to, you know, how well they're performing your portfolio, if they're working with you, mm-hmm. then guess what? They're not going to do as well because they're not aligned. So that's one area. So when you don't have people, there's not incentive alignment, then, you know, people are at cross purposes. And so likewise, when it comes to doctors, what happens is they do the service and then they bill it with these called CPT codes, right? Any service they do, they have to put into their computer or to the EMR, the electronic medical record, and then basically a third party, typically Medicare, Medicaid, or like third party insurer like Aetna or United Healthcare, they're the ones who justify if this patient can get the service you already delivered and how much you're gonna get paid for it. And so now the doctor's like, wait a minute, I saw Jack fix his arm. They paid me 20% less than they paid last time. What happened? Oh, well, Jack didn't qualify. You didn't call us for what they call prior authorization to determine if Jack could even get that procedure, or we just decide that Jack no longer qualifies. And so that's the frustrating part, that whole process of getting paid. And so when the doctors realize that services that they would have, done okay and still okay getting financially incentivized for, they realize that, I can't do that service anymore. So Jack, I can't fix your arm anymore, but if you need surgery, I'll do that because that's going to be higher value for them. And it's given. So
it's higher value.
Yeah. So, and because they see how
God.
much money, and, I'm not saying that doctors are egregious with this, but, it just may seem like you're getting pushed to more of the higher type of surgeries, or they may not see patients like you at all and is focused more on the patients who need the higher value type procedures and services, right?
Capitalism.
Well, when you break it down like that, it's like, it kind of makes sense, right?
It does.
And if you can kind of align, so the way I talk to the doctors, right, about is like, well, look, there's like about 35, 40 different codes that allow you to get paid passively. So yes, they're not a huge amount of dollar from a profitability standpoint, but if you're not using your time, and a doctor's hourly rate is $100, $120 an hour, but you have staff members whose hourly rate could be $21, $22 an hour, and you're not directly involved, but you're overseeing, that passive revenue you generate with some of these remote care programs is almost like you're having the additional revenue coming in. You're a finance guy, right? So what I talk to doctors about is like, look, think of it like this. The reason why you're not valued as much because you're so in the practice. If you're taken out of practice and so someone's supposed to buy you, then it's not going to be worth as much because it's dependent on you, right?
Very
the patients
well
know
said.
you. They know who you are.
100%.
And guess what? If we try to replace your stuff, we're not gonna get as much money for it, right? But if you can create programs that don't rely on you, then you can be valued more, especially if you have recurring revenue models like remote patient monitoring, chronic care management, because that's money that's coming every month as long as these patients are on the program.
And then is that what you help them with?
Yeah, exactly. So that's kind of what we do. We talked about it in our book about practice value creation, just understanding and breaking into how practices can create more value.
It's interesting because YouTubers are talking about like a Mr. Beast type guy.
Yeah.
He'd obviously buy the channel, but like, first off, he wouldn't want to sell it because it's his life, but the value is tied to him as a person. Less now because he has the whole operation down pat.
Feastables, some other stuff
He's
got.
the face. He can't step. He can't be in another. Like he could, and they just use an image from before. But like what you're saying for doctors, like I go to Dr. Greenbaum. If it's not Dr. Greenbaum, I'm not going to that office.
Exactly.
Like, and
it's
that's
the
what
value's tied to him, the doctor himself. And not saying that it's still not tied to him, but it's something that is not taking his time, right? People always say time equals money, but no, time is way more valuable than money. And so if you can take out your time and still get revenue from some services, then I think that's where a lot of doctors need to get to.
Doctors aren't trained like that because they're trained to, they go to medical school, they study, they put their time in to then make a lot of money. They get paid for the work that they do, like the help that they give the patients. So they're used to trading time for money. But I was talking to a guy before, and he said it really well. Like doctors are extremely smart in their niche, great with that specialty, but everything else, they don't really know, but they think they know. So then they think that this money valuation in their head is accurate, but the reality is if they take themselves out, it actually makes the business 1,000 times more valuable, and they just don't see it like that.
Yeah, a logic fallacy. When you are biased based on your limited knowledge set, so just because I know everything is about Fast and the Furious movies, right? Doesn't mean I'm a director, right?
Yeah, of course.
But she's like, oh, I know how the cars are set up and all that. But do you actually know that there was a movie that just came out? I want to say it was called The Menu. It was like a horror film. It was Ray Fiennes is in it, and
we were talking about this, The Menu?
Yeah, The Menu.
I don't know the movie, but we were talking about that this weekend. My friends and I just brought that movie up for some reason. I don't know.
So yeah, it's kind of interesting. It's basically these foodies, they get together, this classic food celebrity chef. He's been missing for like forever. He opens up this restaurant finally, and it's like so exclusive. You get a special invite, and it's off in the island, and like only special people get to go. And this is his last menu. He says, I'm not gonna cook anymore. Go see the movie, I'm not gonna spoil it, but basically craziness happens. But the point I'm trying to make is one of the foodies, there, he's sitting there and taking pictures of the food, and he knows everything about the food. Look all the elements he did to create it. Oh, he boils it to a certain degree, so he knows it intellectually. The chef says, oh, so you know it. Well, go ahead and cook it. He's like, what? So when he started to cook, and he doesn't know it, right? But he knows it intellectually. And likewise, I use that example to say doctors, they know especially pretty well, but then when it comes to like finance or just running their practices, it can be a little misleading and they get a little overconfident sometimes. And that's why consultants like myself can come in and kind of guide them. We do things like practice audit, where we go in and kind of look at their practice. We can look at their billable claims for the last couple of years, see what CPT codes they missed on that tie into these billable codes that we talked about. That's passive revenue. and see opportunities that they missed that they never saw before. And so I think the hardest part is just that doctors have to realize that I may not know everything, but I can get someone that I can trust. And we try to provide value on talking about this from a video standpoint so they can feel like we understand their background, what their care abouts, and how we can get to the next level. So that's why we do this and talk about building value for practices and medical practice specifically.
I didn't even realize that this was part of your offering.
Yeah.
I was thinking just telehealth, but that is
That's
also
the beginning
very
part of
valuable.
it, because now it opens the conversation.
That's
more.
your lead. Yeah, it's a leader.
Yeah, it's the
And
lead
then-
offer where we can kind of say, hey, well, you don't know where you are unless you put a point in the map and say, hey, this is where you are, right? Like when you go to the mall, right? They always say, so how do I get to Macy's or whatever? Well, first you gotta know you are here. Where's the red dot? And then from there, you can kind of that's dated reference. I don't know how people go to malls anymore, but then you can find yourself, where you need to go. And so our goal is to kind of say, hey, this is where you are. Here's how you can get there with these steps. And that's when we talk about the remote care programs, but also there could be things like operations you need to do. Like, what are the things in operations that you're not hiring enough mid-levels? So mid-levels for doctors would be like nurses that can come in and kind of offset some of the services that you offer to your patients. What are some of the things that you're doing from a financial standpoint, like your taxes? Are you taking advantage of tax rebates and things like that? What are you doing with marketing efforts, right? How are you kind of communicating and getting patients into your practice? So all these things, I think are some of the things that we try to offer because we want to create the most value, right, for the practices long term. And that's why we came up with the practice value creation.
So it started as a telehealth company. Did you basically just learn the rest of how these businesses function throughout your creation of it? per se?
Absolutely, yeah. I've been doing this for 10 years, and so just learning the business of healthcare, right, over time. And I actually taught a little bit like healthcare innovation at Georgia State, so we
Nice.
can understand like the where it was going.
Teaching helps you understand.
Yeah,
it better, too.
absolutely. But really just being in the trenches with the doctors and seeing the pain that they go through. For instance, we talked about a recent healthcare hack where the billing was hurt tremendously for a lot of doctors because they had these things called clearinghouses that weren't getting the billing through as it should. So basically the clearinghouse cleans up the data that you submit for your billing and submits it so that it can get paid effectively. Well, that was broken because there's a big hack for this company called Change Healthcare. It was Change Healthcare. It was a big clearinghouse, affected 80% of doctors out there, from large healthcare systems to small practices. So they could not get any billing out for like a couple of weeks. If you're a small practice and your margins are like 2 to 3%, that was hurting you bad because now you weren't getting paid and now you had to make payroll. And so that a lot of doctors got affected by that. And so simple things is like, okay, well, do you have 2 different clearinghouses so you're protected for instances like that, right? A lot of them didn't, So it's stuff like that. And I think it's going to get more prevalent. And that's why a lot of doctors is like going back and forth between being hired for a hospital. But the challenge with that is now you're an employee. So now you have metrics to meet. And the hospitals know they can get more money, especially in primary care, and they just put more volume on you. So instead of seeing 15 patients a day, you're seeing 20, 25. It's like the frog in the boiling water, right? They
Yeah.
slowly boil it up. And you're like, I can't see 20, 30 patients in a day and still get paid the same amount of money. Then the doctor switch over to independent. Then they struggle there because now they're struggling with like how you build a practice up, how you get enough paying patients in, how you build mid-levels in to kind of handle the staff. And so, like I said, our goal is to kind of help them. If they're looking to do the independent path, we can kind of get them there. If they want to stay where they are, that's fine in the employment state. But then there's other pathways to think of how you can augment revenue with understanding these programs so you can put together a pitch to your organization, your healthcare organization, on how these programs will be beneficial. So that's kind of what we do. Okay, I
Doctors
see
should
what
be
you're saying.
educating the patients on like what they should be doing at home. They have more of an expectation to do that. Is that true?
The shift in understanding healthcare is like diet, exercise, right? How do you take care of yourself, prevent these diseases from overcoming you, right? And so there's a big push into wellness and healthcare and all that, but it has expanded. It's not just body, but it's mental wellness now, right? And all the other things that go with that. So what I was saying was that a lot of this is getting pushed to the patient, but then the doctor has to guide them in that behavioral change. The patient can only do so much because just like all of us, I could stand and lose a little pounds, right? I could work out more. We all could do more, right? But the patient can be overwhelmed, right? And the doctor can definitely be overwhelmed because this is like one patient out of, and typically most practices have hundreds, even thousands of patients. So how do you kind of help the patient navigate that journey to take more onus of their own health, right? And that's where our programs come in because it helps with automation of communicating with the patient at home, making sure they do what they need to do, getting the data automatically embedded into the chart. So the doctor's like, hey Jack, last time I saw you, your A1C level was at 6%. But guess what? Since you've been on continuous glucose monitoring, and when I see the data, and you want to do another blood test after 3 months, it's down to 5.7, right? Because that data is coming in, and then are you a sports guy? Do you enjoy sports?
Love sports.
Why do we take score, right? Because people pay attention more. And likewise, getting data back from these devices and technology, everybody's invested now. So the patient's invested because they're like, oh, my score is not going down. Why not? And the doctor's invested, it's like, your score didn't go down. Your high blood pressure didn't go down. Why not? Oh, well, maybe I did eat some more salt than I should have. Or maybe I didn't get my 30 minutes of walking in, Okay, well, let's figure that out together, right? And so it's a journey. And then now that the doctor and patient are more alignment we talked about before, at least the doctor and patient aligned that they both want the patient healthier. And I think that's the key too. So it does help with alignment on that level. And it helps somewhat with alignment too, because now the doctor sees reimbursement that's coming back from these programs that they're doing with their patients.
I
So
think it's also a good business opportunity for doctors, for them. Like you mentioned doctors on social media before, how
Yeah.
there's some with 60,000 followers, but it's a way that they could, first off, they could connect with random people that could potentially be their patients, but also their patients who they've seen maybe, I have a dentist. I go to him once every 6 months. I don't think about my dentist after I'm in the office, but if my dentist is posting on social media, I see his face as a reminder, and it's there's more of a connection between the doctor and the patient, and it
Absolutely.
allows you to then reference, next time in the office, hey doc, I saw this video that you did, loved it, and you have a question about it. It almost I think there is a very valuable path for doctors in general to just take advantage of social media, because they could just connect with more people.
Yeah, let's just break that down. Like I said, I just did some great interviews with several doctors. One is a cardiologist. He's been in social media even before the pandemic. And the one thing he said was that it helped him as a cardiologist to kind of answer questions, because he kept getting the same questions over and over again.
Yeah.
So by, doing a social media presence and answering those questions, he was able to his patients a lot better. Also, people see you more and you build trust, you be a fluencer. And so now there actually have been people who reached out to him and told him his help prevented them from worse fates with dealing with cardiovascular disease and at that level. And so he was able to help individuals that he's not getting reimbursed for, just giving his advice, tell them, if they need help, go directly see their local patient. But that trust level is hard to get. And I think we're seeing even with social media during the pandemic, a lot of misinformation, or even now with stuff going out. But if you can build that trust, especially with someone that knows what they're talking about, that has a degree, that does this for a living,
Yeah.
I think that's way powerful. And so doctors should definitely go into more social media and stuff and do more of that, communicate the value that they bring. Not just for the views, but just to help people.
Yeah, it's only because people at this point, a lot of them are hey, I'm sick of social media. It sucks. No, it's an opportunity that will not go away in our lifetimes. It's only going to get more as kids age. It just becomes more and more important because they're the ones making financial decisions, and it's just you got to be doing it. If you're not, it holds you back.
I mean, you ran a business before.
Do social media work.
Yeah, you do social media work too. But I think the thing I realized is it's a new way of marketing, right? Back in the day, they had a thing called the Yellow Pages. Do you know what that is?
Phone
Vaguely.
numbers?
Yellow Pages.
For phone numbers?
Yeah, phone numbers and
Yeah, I
businesses.
never
right?
used it
Yeah,
before.
exactly.
Yeah.
So this is before your time. But if we wanted to go to a hardware store, I gotta get a hammer. You go on Yellow Pages, look up hardware store, and you had 100 of them, and then you call them, right? That's been replaced by Google search, right? So now you say, I need a hammer, everything pops up, and then people who are selling hammers, because they paid for that view, that search, then that comes up top of the page, just like someone paid to print their business in the Yellow Pages. The new way also is, you remember we watch TV shows, you probably know too much because, but it's like that on YouTube now too, though. You watch something and then something comes up, pop up, it's a commercial, right? They're telling you a book, or they're selling something, or you're selling cereal of your kid. And that's interruption marketing, right? And so that's what YouTube and Facebook are doing, right? So I'm strolling, having fun. Oh, TikTok, haha. Oh, what's this guy? He's selling you something using ads. And so I think that's a new way of just being in front of people. And the organic is just having conversations with people, like a salesperson, right? Who's really trying to help you and guide you, and you trust them over time because they helped you already with some free advice. So why not pay them for more help? And so I think this is the future. And then, when people start to realize that you're consistent with it, which we try to do, and doctors too, you realize that more people, you build a swell of folks that just get to know you more. There's a big thing called in social media, attribution, right? Trying to figure out how did you get that lead to get from Facebook, Google, and stuff like that. A lot of times you don't even know because they'll share a video to their friend. That video got shared to someone else.
iMessage.
And then you're like,
Instagram message,
how
TikTok.
I saw you somewhere here. I said, oh, well, Okay, great. So definitely be on social media, do it more.
All right, so for this book, could you just tell me like what made you write it? Who's it for? How could you buy it?
So yeah, so this book right here, this is a pocket guide to practice value creation, growing your medical practice without burning out. I wrote it. It's a mini guide. It's only about like 70 pages, but just different points of what happens as you try to grow your practice, right? From hiring people, staff, how to work with partners, how to get referral partners, basically other doctors to refer patients to you, how to build these virtual care programs that we talk about, like remote patient monitoring, chronic care management, how to think about your finances. And so it's just really something simple that they can kind of read because doctors don't have a lot of time. So this is something they can really get into and kind of understand. And the reason why I want to offer is so that they can understand like there's opportunities that they're not thinking about. You can go check it out at practicevaluecreator.org and find out more. But the goal here is to just provide awareness of how they can get access to this. It's on Amazon too as well.
Great. Okay.
Free shipping and all that with Amazon, right? But the goal is to become aware. If you do purchase the book, we do have a whole program behind it where they get an email campaign that works through each chapter and making sure they go through the checklist to make sure they're following the pathways. And like I said, the next level of this, if they really want help, we do have a process where they can get an audit where we can go through their practice and see what opportunities exist. So
That's awesome.
Yeah.
And we'll leave a link in the description for the book so you can buy it. I'll put out an ad. If you want, if you're a doctor and you want some social media help, video help, I could help. Extra Virgin Guy is my social media handle. Olive
So-
oil related.
and we'll put it out there too in the
Yeah.
description too. So
Yeah.
definitely check it out. But yeah, that's it.
All right, cool, man.
All
Great
right.
talking to you.
Yeah.
Appreciate your time.
Yeah.